So to introduce this session now, where you've heard of Bevan Healthcare a number of times during the last 2 days, and Mo spoke on the panel today about his experience and his encounter with it. So to begin this introduction by Gina and Gemma about Bevan Healthcare is a short 3-minute video by somebody called Stephen Manley, who has a particular story about his relationship to Bevan.
I hope you're having a good conference. Unfortunately, I can't be with you this year, but we've made a short film so I can tell you my story. My title's handyman, but I do a bit of everything in the building at Bevan, from setting up rooms to painting to repairing radiators, shopping. I take off at reception at dinner time, a bit of everything. My name's Steve Manley. I live in Bradford. Well, I was born in Bradford. I live in Shipley now, which is just a few miles outside of town. I was unemployed. I was suffering from depression. I ended up living on the streets for 12 months. Then, because of living on the streets, I ended up in hospital with malnutrition. Someone from Pathways spotted me, got me into a place called Bricks in Bradford, which look after people who are homeless who have just come out of hospital. The doctor from Bevan used to visit, and I had a discussion with them, and they more or less suggested I start doing volunteer work here, which I did at Bevan House. From there, I started doing part-time work, and now I'm fully employed here. I enjoy people here, and they're good, friendly people. Plus, a lot of people that we deal with are homeless, and I have a little bit of knowledge of how to help with that. We've been at Bevan, they seem to take more notice of you, seem to spend more time looking after you and not just your health, but your well-being and all sort of thing. Since I've been working here, I've had 2 holidays abroad last year, and I'm looking forward to another one this year. Hello, Bevan Wellbeing Centre.
We all love Steve at Bevan, and he really is a walking success story. And I think what it does is it shows that if you do invest in people and see beyond the conditions, see beyond their circumstance, that there's good in everybody, and we've all got something to give, and Bevan has given Steve the opportunity, firstly as a volunteer and now as an employee, to really give back. And Steve has grown as a person and taken a lot from that, but also we learn a lot from Steve, and he's a shining example to our service users as well, that things are temporary in life and it does get better.
There were a piece of paper about me working here, and now I've met up with my brother, some aunties and some nieces. I've seen for about 20 years, so that's been good enough.
So will you welcome Gina Rowlands, who is the Managing Director of Bevan.
Here we go, values at the centre of care. So can I move it on to the next one? Yeah? Oh, there we go, we'll leave it on that one. Hi, I'm Gina Rowlands. I'm the Managing Director at Bevan Healthcare in Bradford and Leeds, and I'm also a nurse. I first came to the Pathway Conference in 2012 with a fellow colleague, Les Goldman, who was GP in the practice, and we'd heard about Nigel and the Pathway and came to the conference. Whilst I was at that conference, faffing about with the sweets and water and whatever on the table, I heard 2 inspiring Americans speak about a integrated model of care in America, and that was Jim O'Connell and Jim Withers. And the model that they developed for the homeless, I was absolutely blown away by. From what they described, I wanted that hope and aspiration for our patients, and I wanted them to have the opportunity to recover, and perhaps for the first time discover themselves. Now, anybody that knows me, I can't take no for an answer where our patients are concerned. Let's just say I'm tenacious, and sometimes I've made myself really unpopular, but you know what, we've got there in the end. Like everyone else in this room today, I attended that conference to be inspired and to push the boundaries. I had no idea what would happen, but it has happened. And with the support of the amazing team of people working at Bevan Healthcare, some who are here today, they're all sat over there in the corner, give them a shout out. It has happened. Without their unfailing support, this would have never have come together. It's been really hard work, and at times it's been immensely challenging. But I've also had unfailing support from the faculty and like-minded colleagues around the country. And I'm looking over at the chaps now from Edinburgh and the team from over in Manchester. So Bevan Healthcare, how did it all come together? It's so named after an Aaron Bevan who fought passionately for the NHS in 1948. He urged us all to take pride in the fact that despite our financial and economic uncertainties, we are still able to do the most civilised thing in the world and put the welfare of the sick in front of every other consideration, and how true that still is today. Originally, Les Goldman and I, and Les is also a fellow of the faculty, set up a small PMS practice in Bradford in 2003. Bradford is a city with high levels of deprivation and poverty, and none more so than in the city centre where we are based. There's severe deprivation around that particular area, and that's where the majority of our patients are, but they are citywide, as well as in Leeds. Something happened in 2011 with the changes in commissioning, and we had the opportunity to form a social enterprise, of which we did. There were 9 staff and 1,400 patients at that time, and I don't think we quite knew what we were getting into, but you know what? Sometimes in life you have to take a punt, haven't you, and just absolutely go for it. And now across the 2 cities of Leeds and Bradford, we have 6,500 patients of the homeless, asylum seekers and refugees and other vulnerable groups, and 70 staff. And we've continued to be driven on by our motto, which is health, hope and humanity. The integrated model care that we've developed, Jen will talk about that in more detail, is in terms of our health and wellbeing model. We have the practice in the middle and then all the services wrapped around it. There's no doubt it's been hugely successful and recognised nationally. As Steve Field was very generous to point out yesterday, we received outstanding at the CQC. And we've even made it into the 10-year plan. Check us out. The pathway are on page 42 and we're on page 43. So for 2 small organisations, fantastic. But it couldn't have been done without the faculty and everything that it encompasses. The experts by experience, and Steve is testimony to that, Mo and Dominic, who's here today, sat down here with his curly hair. And the experts have driven it on because they've been the centre of our work. But also the academics that are around here as well, and everybody that contributes to the research, the papers, and all the inspiring people that are around us. And I think we've become positive system disruptors, and there's nothing wrong with that, and that makes up Inclusion Health in general. But also key to the success is the collaboration and meaningful partnerships. Not just partnerships of people that you cursory know, but people that you can really turn to when times are difficult or when you really don't know what to do next, who give you really sound advice and give you encouragement to keep moving on, particularly in terms of leadership, which at times can be desperately hard and sometimes really quite lonely, but I always know where to go. So we'll continue to develop. I don't know where it'll go next. We still have our challenges. But we'll continue to listen and be inspired by our patients and our service users. So now I'm going to hand you over to Jen, who'll talk to you a bit more about the model. Thank you.
So hi, I'm Gemma Ashwell, one of the GPs at Bevan in Bradford. So first I'd like to say it's a real pleasure to be able to be here today and talk to you all about our services, particularly when there's tons of people in the audience who've inspired what we do and helped to develop our services along the way. So as we all know, last year we were celebrating the 70th anniversary of the NHS, and I'm sure we're all in agreement about what an amazing and important organisation it is. But nothing's flawless, and the inverse care law, that those who most need good medical care are the least likely to receive it, is unfortunately still fairly applicable today, 50 years after that expression was first coined by Julian Tudor Hart. So Bevan has developed to directly challenge this, At the core of everything we do is providing the best care possible for those patients who need it the most. So what I'm just going to do for the next 10 minutes is just give a bit of an overview of our joined up care and how our values have shaped these services. So we heard from Steve at the video of the start, and I'd like to go back to Steve's story that he was kind enough to share with us. So Steve first came into contact with Bevan through our Pathway team. This was the first outreach service that we developed and is now one of 10 teams across the country. The Bevan Pathway team in Bradford consists of 2 nurses and a housing support worker. They've been based in the hospital, in the local hospital, the Bradford Royal Infirmary, full-time, 5 days a week for the past 6 years, which means they're really well known to the staff at the hospital. So if a patient's admitted who's homeless, the staff know who to contact. And the Pathway team will help the patients in any way they can to navigate the complexities of an inpatient stay, whether that's liaising between the hospital and community services, or simply providing support and supplies such as toiletries for patients who don't have family or friends. But crucially, they plan a discharge that's going to put the patient in a much better position when they leave hospital to when they arrived. Once we'd set up the Pathway team and it was well established, there was an obvious gap in the service. It was obvious that there were patients who would be medically fit for discharge if they were going to be discharged to a home environment, but not if they were going to be discharged back to the streets or to whichever unstable accommodation they'd come from. And that's why we developed Bricks. So Bricks, Steve mentioned, is our 14-bed respite care facility, which is located close to the surgery in Bradford. As was the case with Steve, patients can be admitted to Bricks directly from hospital, or they can be admitted from the community if they've got significant physical health problems, putting them at risk of discharge, and they're in unstable or unsuitable accommodation. So in this initiative, we're bringing together health and housing. So it's a collaboration between Bevan and our partners Horton from one of the local housing associations. Our housing partners provide a support worker 24 hours a day at Bricks, and they provide individual support workers for each patient so they can help people get to hospital appointments and they can help them become ready for their next tenancy into longer-term accommodation. From the health side, we have a Bevan GP who visits and does a ward round once a week with our outreach nurse. And Helen, our outreach nurse, can visit a bit more flexibly and frequently as required between ward rounds. And the patients at Bricks all have direct access to the doctors and nurses at Bevan if they need that in between times. The patients that we have at Bricks tend to be have very complex physical needs, often alongside mental health and substance misuse issues. But when we look at the types of patients we've had at Bricks, I think it's fairly invaluable. So, for example, I remember caring for a newly diagnosed diabetic patient who was sleeping out or sofa surfing, mixture of the two. And to imagine, it's pretty impossible to cope with your insulin injections, your sharp boxes, your glucose monitoring, and it's hard to cope with that anyway, let alone if you're out on the streets or in sleeping between different people's sofas. We've also been, I suppose, privileged to be able to provide end-of-life care for quite a few patients over the last few years, to be able to give people more choice about where they want to be and where they're going to be most comfortable at this crucial time. The third part of our outreach services is our street medicine team. This is the part that we use to intervene at an earlier stage and potentially could have prevented Steve from getting so ill and to the point of needing hospital treatment. So our street medicine team takes healthcare directly out to people who are homeless so that they can access care at a time and a place that works for them. And we do this in several ways. So firstly, we have our street medicine bus. So this is a couple of pictures of the inside of the bus. Once you're in there, you feel like you're in a normal, regular consulting room. So we've got a couch with a light, we've got a desk, computer, We've even got a toilet and sink in there. So we take the bus out to various charitable food drops and soup kitchens across Bradford, and now recently into Leeds as well. We also drop into local hostels, and to try to engage those who are really potentially hardest to reach, we do traditional street medicine, and we set out and walk the streets with support workers to try to engage if we can, if people wish to and want to. So the main aim is to reach people who aren't registered with a GP and aren't getting help with their health needs. Our street medicine service is growing, and as I say, we're thrilled to have recently been able to drive our bus over into Leeds to expand our services there. In the past year in Bradford alone, we've seen more than 800 people. 70% of those who weren't registered with a GP before they saw us subsequently go on to be registered. But there are some limitations to what we can do for patients in the outreach setting. So we wanted to make our services in the practice as accessible as possible for people experiencing the challenges of homelessness. So we've started regular drop-in clinics. So patients can come without an appointment, without even being registered at the practice, and see a GP, nurse, mental health nurse, and housing worker all at the same time in one of our drop-in clinics. But this leads me to talking about the practices. So we have 2 practices, as Gina said, in Bradford and in Leeds. And we provide care in really whatever form works best for some of the most excluded patients in the 2 cities. Our services have been developed together with our experts by experience, who were key in such things as the design of the building, so suggesting that we needed a quiet waiting room as well as our busy main one. And we were just chatting to Stan earlier about the peer-to-peer service evaluation that our experts by experience led, which was really invaluable. In Bradford, about 40% of our patients are homeless or unstably housed, and around 60% are refugees or asylum seekers. I think we have one of the highest, if not the highest, numbers of Syrian refugees of any city in the country. And we have an in-house Arabic interpreter available every day for that purpose. Interesting, our Leeds practice has the opposite proportions, about 2/3 homeless patients and about 1/3 asylum seekers and refugees. We have all the services you'd expect of a traditional GP surgery, podiatry, physiotherapy, but we have some more unusual clinics in the practice. As you're all aware, people, particularly homeless people, can struggle to access dental care. So we have a basic dental service in the practice. And likewise, we've had discussions over the past 2 days about difficulty of homeless patients accessing testing and treatment for hepatitis C. So we're pleased to have a nurse-led clinic. One of the hepatitis nurses from the hospital runs a clinic very flexibly every week. We have also had discussions in the last 2 days about the high needs of women involved in prostitution, and to cater best for the needs of these patients, we have a late night clinic at a time chosen by the women. So we run that till 11 o'clock on a Thursday evening in a women-only environment with staff specialised in contraception and sexual health services. And if we need to admit people from hospital from any of those clinics, we can call our pathway team who can support the patients when they get there. Or, as necessary, perhaps we can admit people straight to bricks, really helping with the seamless joined-up care. Clearly, we realise that medical care is really only a very small part of the solution to much, much bigger problems, as we've been discussing, problems such as material poverty, psychological needs and social connections. So we're trying to take action beyond purely medical care through our Wellbeing Centre and our education programme. Our Wellbeing Centre is one of our newest initiatives. We've converted the top floor of our Bradford building into a space dedicated to courses and activities for our patients. We started off with simply cooking classes and English language classes, and now we've gone on to develop more than 10 different sessions based on what our patients have said that they need. One of the more recent additions has been We noticed that we had a lot of women who were experiencing domestic abuse. So we started a therapy through arts and crafts session led by a specialist mental health nurse. We're thrilled to have a social prescriber who's a key link between our health and our wellbeing centre, and she can assess individual patient needs and refer them to the appropriate service, whether it's in the wellbeing centre or externally. And experts by experience, again, have been crucial in designing the sessions, leading some of the sessions and advising us on our timetable. I remember they weren't backwards in telling us that having tea and toast on a Tuesday morning was a complete waste of time when a fry-up was on offer by a different service down the road. But for all of this work to be really sustainable, we're passionate about educating the future workforce so people can take over these values and work. So we're doing everything that we can to share what we know. We're training nurses at the practice. We've just become a GP training practice, and we're delighted to have our first trainee with us here for these couple of days. Several of us work at Leeds University as well, trying to incorporate these values to the undergraduate students. And we have medical students joining us for our street medicine sessions every week, who get an amazing insight into the lives of excluded patients who I think they rarely get the chance to interact with. So we hope all of this will lead to doctors and nurses and healthcare professionals in the future who don't have any stigma, and there's no further discrimination and prejudice, and people aren't being turned away from being registered inappropriately. So we share our values in the hope that they will become compassionate, caring professionals, equipped and confident to deal with the needs, to deal with those most in need of good medical care. When we were asked to do this talk on values at the centre of care, we wanted to know what our whole team thought Bevan's main values were. So we asked everyone to write down what the main values they thought were from their perspective. So this word picture shows those values from all the staff, with the more frequently mentioned values being the ones in larger font. So I think it's clear to say and fair to say that compassion is really at the centre of everything that we do. Finally, I'd like to say how none of this would have been possible without Gina and Les from having the courage and the foresight to start Bevan back in 2003. And then without Gina's inspirational and visionary leadership over the last few years, and her tenacity, as she said. Thanks also to Steve for sharing his personal story with us. And thanks to you all as well for listening at the end of what's been another really inspiring conference.
Just before Laura goes, listening to you, that strikes me as being a really good, I'm trying to think of the right word. It sounds to me like the kind of practice that I would want, and I'm not homeless, and I don't have anything. What is it about the model, when you look at other practices that you are doing, that your run-of-the-mill, what we might call, Alistair Campbell's like bog standard GP practices do or don't do? In what ways are you specifically different?
I think the very fact that we're a social enterprise has made a huge difference.
Because?
Because it's not the partnership model. And it also enables us to maybe look for other sources of funding that maybe mainstream practices can't.
And not being a partnership, how does that help you design the services differently?
Because the staff are completely immersed and involved in it. Being a social enterprise allows us to have a lot more innovation, flexibility. We don't always have to, go through all that bureaucratic stuff around the NHS. It also enables us to bid for money to the big lottery. That's how we got our health and wellbeing centre. Right. There was a pot of money available, and we called it Crisis to Futures, that we could bid for. There were 750 applicants, and they actually gave out money to 20 organisations, and we were lucky to be one of them. And so we developed the model then. So that gives us, different ways of working and developing it. But what's absolutely entrenched in the service is the values. We're absolutely values driven. And that has made a huge difference to us.
Because it's clearly a model that other practices could learn from. Do you have any basis to understand whether your health outcomes, albeit perhaps starting from a lower base, I don't know, but are your health outcomes better with your patients than a bog standard practice would be?
Well,
Wow.
the average age of death of our patients is 46 in our Bradford practice and 43 in our Leeds practice. So I don't think that's a reflection on the service that we provide, but I think that, I hope, but I think that illustrates the complexity of the patients that we're dealing with.
Sure. I just wondered in the model whether there's any, whether you've ever compared, adjusting for the base from which you start, whether you've ever compared health outcomes between an ordinary practice, so to speak, in your practice. I just wonder whether you're getting better health outcomes.
I don't think we necessarily have, because it's so different, it's so diverse. The average age of our practice population is 34 years old. So our chronic disease management, unlike other mainstream general practices that will have dementia, atrial fibrillation, etc., our chronic disease management, a lot of mental health, a lot of enduring mental health problems, and HIV, Hep C. So they're more our, a lot of sexual health work as well. So they're more some of our chronic disease work.
No, I was just so struck by the idea that one could walk in without an appointment and be seen when one was ill, because certainly in the practice I go to in Brighton, one tends to have to be ill when they want me to be ill.
But
The drop-in appointments are for people who are homeless.
Yeah.
So they're not for,
Yeah.
So we've basically tried to make the services most available for those with the greatest need. So if the target of the drop-in services are homeless patients who aren't accessing healthcare, so once they're engaged in accessing care, then we're encouraging them to use the service in a more normal way. So it's really for that sharp end. And similarly for the late night drop-in for women involved in prostitution, it's really engaging those women who just aren't seeing GPs at any other times. So that's the reason that we have.
But there must be a read across. That's why I'm so trying to plumb this, because the experience of people who are at the really tough end must be able to illustrate that more general GP provision. So what you're doing must, it seems to me, to be leading.
It's a lot of flexibility. There is no point saying, and you all know this in this room, to somebody, would you like to come back next Wednesday at 3:00 in the afternoon? You are setting yourself and them up to fail. So by having lots of different ways of access, the street medicine service, the drop-in, triage at first thing in the morning, booked appointments, it just gives people plenty of opportunity to come in, because everybody knows with our patients, whether they're homeless, asylum seekers, refugees, sometimes they just feel as though they need to be seen now.
Yes.
So it's a one-stop shop, really.
Well, fantastic. Do show your appreciation to Bevan Healthcare.
Thank you.